In New Brunswick, I work at one of the provincial clinics. There are several clinics in New Brunswick, and we've actually historically had pretty good access to treatment here. There are a couple of very effective medications. One is methadone. There's a lot of stigma around being on methadone, but it is a very effective medication to treat opioid use disorder. There are some newer medications. One is called buprenorphine naloxone, which is brand name Suboxone, which is easier to pronounce for some people. And both those medications are given daily. Often you start out going to the pharmacy every day for them. They are effective because they block the euphoria from using other opioids, so you don't get that rush that people get, and it really takes a lot of the reason for using the opioids away. So it's a pretty effective medication if you prescribe it. There's also a newer option. It's a monthly injection. It's buprenorphine XR, extended release. It's very effective as well, and I really like it in New Brunswick, where we have lots of rural patients in treatment, because they can get to wherever they need to go for their injection once a month, and they're not going to pharmacy daily or even weekly. And it allows people to kind of go about their business and live their lives a little bit more normally. There are a couple of other replacement opioids that are used for opioid use disorder. One is like a slow-release oral morphine. When people are ready and engaged, therapy along with medication is very helpful. The type of therapy would really depend on what issues the person has. People do benefit from relapse prevention and that kind of substance use disorder support, but if they have an anxiety disorder, maybe they need a specific intervention for that. If they have PTSD, maybe they need a specific intervention for that. Psychotherapy, group therapy, you know, some people find things like acupuncture helpful. There's also peer support groups, 12-step programs. We treat First Nations people in the area. We work with people who may provide traditional support ceremonies, sweat lodge ceremonies that are very effective. And I think what is really important for all of that is the connection and support people get in their community to start to live their lives a little bit more normally, and they become less isolated. You can go to the Horizon website and search for mental health and addictions, and there are some regional contact numbers you can call for more information. Here in Fredericton, we take walk-ins and get your information. You can also talk to a healthcare provider to get a referral or to get more guidance as to what's available in your community.